This is an annual meeting to really talk about the state-of-the-art research on sarcopenia and frailty, with the idea that, it helps disseminate the most current information about those things to other people that are doing work in these areas. Well, I think the good thing is that almost always when you go see your general practitioner or doctor, he always usually asks you about how much exercise you do and recommends that you do exercise. The problem is that doctors aren't necessarily trained in prescribing exercise or knowing, unless they exercise themselves, what the best type and amount and dose of exercise is for someone to perform and how that might change as somebody ages, for example. Exercise is important. It is a little bit problematic because I think most people get the most sort of valid health information from their own primary care physician. So the more we can do about educating physicians about the benefits of exercise and how to effectively prescribe exercise, I think the better off their patients are going to be. Exercise is a behavior, right? So you have to be able to sort of integrate that behavior into whatever your typical daily life is already. So while it's good to say that exercise is good for you, and we know the benefits of exercise pretty well across the lifespan, to actually get people to be more engaged in physical activity and to exercise more is still very challenging. The newest science, I think, is that not only does exercise improve muscle health and muscle function and muscle strength, but it also can improve your physical functioning, your ability to perform tasks, and reduces your risk of becoming disabled as you get older. The big thing is, first of all, we still need to really get a uniform definition and clinical diagnosis of what sarcopenia is. We're working on that from multiple different angles, but we're coming to some agreement about that. Secondly, I think we have to get both clinicians and the public to understand that muscle health is important as people get older, and that the reason an older person has trouble getting up out of a chair is because they have a problem with their muscles. And if they start thinking about that, they might then start thinking about, okay, what can I do to prevent these problems from occurring?